As states begin to figure out ways to return to normal activity, contact tracing is being viewed as an important weapon in controlling the spread of COVID-19. But it is also raising larger privacy and ethical concerns. Joining me now on Skype to take a closer look at the ethical implications of all of this is Father Michael Rozier, Assistant Professor of Health Management and Policy in the College for Public Health and Social Justice at St. Louis University. Father, welcome to the show.
Thank you, Tracy. It's a pleasure to join you.
So contact tracing has been used in this country and also around the world as a way to stop people who may be unknowingly infected with the disease from spreading it. Can you talk about how this process typically works and how that information is usually collected?
Absolutely. So contact tracing is a cornerstone activity of public health, and it begins with somebody who is known to be infected with a contagious or communicable disease. And then we gather information either through interviews or technology to determine who have they been in contact with while they may have been infectious. Then we contact those people to let them know that they should either monitor their symptoms or quarantine, get the support that they need in an effort to stop the disease from spreading any further.
Father, from a health and public policy perspective, how could this data be used to help curb the spread of the coronavirus here in the U.S.?
Yeah, so when the infection is able to be identified and stopped before it's spreading to other people, what that allows us to do is to get ahead of the disease. So whenever we can identify people before they are symptomatic as potentially spreading the disease, we're able to stop the infection before it moves further through the community. And so we use these interviews and additional technology to help people raise their awareness that they may have been exposed, even though they may not have known that they came into contact with an infectious person.
I know that some people have suggested that smartphone technology can help with this tracking, and also that Google and Apple actually announced that they've been working together on software. Can you talk about maybe some of the privacy concerns associated with that? And is there anything that you find troubling about this type of tracking or tracing?
Yeah, so I think there are a couple ethical concerns that we have to keep in mind as we move into the phase of contact tracing. One, as you mentioned, is violations of privacy. So this is very sensitive information that we'll be gathering. And so we need to make sure that we are only using it for the public health purposes for which it is intended, and that we're transparent and accountable about who has this information, how they use it, and how a program is terminated after the intervention is complete. Some other ethical concerns that I think we need to be aware of is that whenever we give people information, we need to make sure that they have the necessary resources to act on that information. So we don't want to tell somebody that they might be infected and need to quarantine without making sure that we have the supportive resources in place to ensure that they can quarantine or isolate safely. And then, of course, when we do public health interventions, we're worried about the equity across different groups within our population. So we want to make sure that these kind of interventions don't just positively affect people who already have resources, who have access to health information, who have access to health services, but that it's equitably distributed so that the people who are most in need are the people who are able to benefit most from the kind of public health interventions that we'll be introducing on the other side of the peak of this epidemic curve.
Well, Father, thank you so much for your time and insight today. We really appreciate it. Father Michael Rozier, Assistant Professor of Health Management and Policy at St. Louis University. Thank you again.
Thank you.